Unvaccinated medical practitioners at the Georgetown Public Hospital and the administration of the hospital are both standing firm as the government has started enforced vaccination measures for those who refuse to be vaccinated. Further, those persons were required to produce a negative PCR test from a private institution. Today is day 5 of the standoff, and the medical practitioners, despite threats of a pay cut, remain resolute. Don Gardner, first vice president of the GPSU, said from Thursday last today, the workers have been reporting for duty as usual based on the shift they are assigned to work. She said the bullyism must stop and our union is moving to the courts on the matter.
Well, the union should be taking legal action, and which should be filed shortly. So the court will deal with this matter because I think it's getting out of control. To date, the government hasn't seen it fit to sit and talk with these workers' representatives to discuss the whole issue about the vaccines and the negative PCR test. Therefore, you were telling me that these workers are not important to you. They should not be consulted. As a leader, that is what you want to do. You want to make arbitrary decisions. No, you have to include. You have to include. And I think they should take a pattern from Barbados Prime Minister. I think they should take a pattern from the administration, the politicians in Barbados. Not to make it mandatory, but to go and talk with the people, include the people. Find out from them what is happening. Encourage them. Give them necessary support. You know how important it is for you as a leader to support your colleagues, to support your workers, to support your supporters, to even support your unsupporters. It is important. It is very important because you're telling everybody how important they are to the development of your country.
Gardner said more unvaccinated workers are locked out than those who were vaccinated. But Health Minister Dr. Frank Anthony differs.
Unvaccinated workers at GPHC is more than the vaccinated. Yes, I don't have a figure that I can share with you currently, but there is a figure. But what I want you to know too is that while the minister going out there and making statements that the unvaccinated workers being locked out is not preventing the services, I need him to be honest with you, with the public. Inform the public what is it that they are doing. They are driving fear into these workers, allowing some of the unvaccinated workers into the hospital. Listen to me very carefully. Allowing some of the unvaccinated workers into the hospital to provide services. Within a certain time after providing the services, they're letting them out. So why is it that you recognize that these workers are important to providing the service and you allowing them in? When the service is being provided, you're then chasing them out. You're chasing them out. I think that is unfair and is disrespectful to these workers. It's most disrespectful. Again, it should be condemned, and it should be strongly condemned.
The union is also against workers who refuse to be vaccinated, having to pay for PCR tests privately.
The workers are not comfortable currently in taking the vaccine. And secondly, what is more important is that they cannot afford to take a PCR test every day or every 2 days. These workers are poorly paid public servants. And tell me, who is living not only on paycheck to paycheck? Before another paycheck comes, these workers don't have monies. And you're telling me in this crisis here, you're telling these workers, you're forcing them to take a negative PCR test. Why can't you provide a PCR test at the public hospital without a cost? Why can the government take the cost of the PCR test? I really don't understand. It is getting me as a citizen of this country thinking more and more. What is the government's position actually? What is the aim of the government?
Meanwhile, unvaccinated staff at the Ministry of Legal Affairs were also locked out this morning as the government enforced COVID-19 measures. Many of the workers are hesitant to take the vaccine and are questioning why the administration cannot make the PCR test for free at public hospitals.